joining us today on Feelin Good, sponsored by Warren County Community Services. I'm your host, Shelly Abrams, and today we are delving into a very timely topic that we thought our audience, all of you, might be very interested in. And so we invited a guest who visited with us. Can you believe this? In 2019. We could not believe the time had flown so quickly. Christina Reeg from OSHIP. And OSHIP will be explained further when we start talking with Christina. Welcome. Thanks for coming back to our show.
Thank you for having me. It's good to be back.
Great, great. Well, tell us a little bit about your position with OSHIP, and please explain what you do, first of all, okay?
Absolutely.
All righty.
I am the program director for the Ohio Senior Health Insurance Information Program, or OSHIP. With a P. We're careful with that P. But essentially, we are the Medicare education source for Ohio. We are federally funded by the U.S. Department of Health and Human Services, which is Medicare, to provide objective, unbiased information about all things Medicare related. We physically sit within the state Ohio Department of Insurance, which is your regulatory agency for insurance sales and agents. So in a nutshell, we're here to provide that objective information, ideally give folks enough knowledge so they make wise decisions when it comes to their health and their drug plans.
Very good. And the reason that we are talking today, and this show will be broadcast in October. Mm-hmm. And tell us the significance of the timing of why we ask you back.
It's very good timing. This is the time for the fall open enrollment period. October 15th to December 7th is the time frame when all Medicare folks should be reviewing those health and drug plans. And then if they need or want to make a change, do so by December 7th, and that change goes into effect January 1st. So it's open enrollment. The mailboxes, inboxes are full of marketing stuff. We want to help you kind of sort through that to get the factual information.
So you are the unbiased group. Usually when we were just talking robocalls and all different outreach, calls that we may receive are usually trying to sell their product, correct?
Absolutely. Yeah, we really encourage everyone to make an informed decision, an individualized decision. What are their needs for prescription drugs? What are their needs for providers and different network facilities that they want to use? Do not make an enrollment decision based on the marketing ads. They are rampant this time of year. Mm-hmm. They really are. And they're usually making promises of extra benefits or money back or benefits that you're entitled to. It's an enticement to get you to make that initial phone call. And a couple things. One, yes, they want to enroll you. They want to make a commission off of that enrollment, and perhaps not assisting you with making the best plan decision. But also you're making first contact, and your number will be sold at that point. To steal a line from Pro Seniors, which protects from Medicare fraud, it's shrewd to be rude. You don't have to pick up the phone when you don't recognize the number. Don't call those numbers that you see on TV. A lot of them try to look like government numbers, but they're not. They're brokers, and they're typically out of state trying to make a sale.
Well, I really appreciate that tip, because we were all just talking before the show that we receive those calls, so much, and it seems like it's difficult to sort through.
It's extremely hard to sort through, and it's your television set, your inbox, your phone, text messages.
Right.
At this time of year, you're just inundated with marketing material. So it's very important. Look for material that comes from Social Security. the Social Security Administration, from Medicare, which is the Centers for Medicare and Medicaid Services, or CMS. That is the official Medicare office. And anything that's coming from your current plan. In fact, you should have already received your annual notice of change, or ANOC. That is a critical document. It discusses everything that's changing in your plan for the upcoming calendar year. And we've already seen ANOCs that show your premium might be tripling. That's not highlighted on page 1, but it's within that document. So that's someone that would really want to review their plans for the upcoming year.
Well, we had an interview, a very interesting interview for Feelin Good. I think it was about 3 months ago, and it was with a retired professor at Miami who does research on demographic changes and the impact on life in general with the changes in the demographics. And the demographic that jumped out at me was the age 65 and older group will be and is currently in the midst of exceeding all other demographic groups for the first time in history. So the baby boomers are, which I am, of course, one of the baby boomers, we are part of the largest group now for the first time in history in terms of demographic shifts, which I would say has an impact on what you do and maybe the demand for your explanations about Medicare and other questions.
I couldn't have said it better myself. Ohio welcomes on average 100,000 new Medicare beneficiaries every year. Every year, and that is not slowing down. So yes, the demand for our services has absolutely grown exponentially. The scope, the amount of plan options out there. Individuals have to first choose, do they want to stay on original Medicare, Part A and Part B, shop for supplemental insurance, and then a Part D plan, like 3 cards in your wallet? Or do they want to shop for a Medicare Advantage plan, which is option 2? There are counties in Ohio that have 100 options to choose from. So we are sought out to kind of help weed through that high number of plans.
So if I were to call you and say, Chris, I need your help, what would you say to me?
There's a lot of different starting points. So folks that are new to Medicare and just starting out on that path, one, we do focus our entire spring campaign on Welcome to Medicare. We have year-round webinars and trainings for those that are new to Medicare to make that initial decision. But the key thing is understanding the benefits and making a choice that is what you need as an individual. Not what your neighbor said they have, not what the card club is pushing you to join, but what you want as an individual. Also, we want to check to see if you have retirement benefits. A lot of folks have very lucrative retirement benefits available to them. And if you enroll in a private plan, you could jeopardize those retirement plans. So I think if you were to call us, and we're there Monday through Friday, 7:30 to 5, to take your phone calls, we really want to find out more about you and what are your needs for health and prescription drug plans.
So you would ask me about any medical issues I might have or any procedures that are coming up that I know of, or what would you
and
say?
A little bit more broadly, we'd want to know, first and foremost, what coverage do you have?
Okay.
Is that going to continue when you're on Medicare? Do you need to make a plan choice? But if you share with us that you do have medical conditions, we're probably going to focus on who are those providers. Do you have providers that you're not willing to give up? And that's going to help us narrow down the plan options. When you're new to Medicare, if you're shopping for a supplement plan, you have an open enrollment for supplements without medical underwriting or screenings for pre-existing conditions. Medicare Advantage plans, if you're shopping for those, they do not medically underwrite. So there's a lot of enrollment timeframes that we're going to go through and find out what is the best scenario for you.
Well, I noticed, and I mentioned to you today, the art bulletin.
Yeah.
This was the most recent art bulletin, and it says historic new law, sweeping changes on the front. And your comment was,
we hope so. One thing we do know about it's the Inflation Reduction Act. We do know that insulin will be capped at $35. So for individuals that are taking insulin, it is critical this year that they review their at minimum prescription drug coverage. We know that it might not be in time for Medicare.gov to have that upcoming price, but we know it will be capped at the pharmacies next year at $35. Other medications over the course of the next several years will have limitations on cost. We're not as certain as what those costs will be yet, but insulin is the big one to look for this fall.
okay, very good. Well, I know that when we all read in the paper the headlines, or we get, receive our newsletters and so forth in the mail, it actually is quite overwhelming.
Yes.
And sometimes you hesitate to do anything because you don't want to do the wrong thing. So a call to you would be, or your office, would be a very safe and secure starting point. Would you say that?
Absolutely. If you don't know who to call, start with us.
Okay.
Again, we'll provide objective, unbiased information. But not doing anything during open enrollment is also a choice. Choosing to do nothing is a choice, and you'll be in your current plan come January 1, 2023. That may or may not be the best plan that you could be enrolled in.
Okay. And while we're talking about phone numbers, would you like to give the best contact information?
OSHIP is 1-800-686-1578. Monday through Friday, 7:30 a.m. to 5 o'clock p.m. And we encourage folks after, we're in October, the plans are up. We can do the comparison using Medicare's Plan Finder tool. And they can also call 1-800-MEDICARE 24 hours a day. Both are sources of objective information.
Okay, very good. I'd be interested to know, how did you actually get into this line of work?
My background was human resource management.
Okay.
So I did a lot of benefits administration for companies. And a friend of a friend said there was a position within this program called OSHIP. And I checked it out, and 25 years later, I'm still with OSHIP. I truly believe in this program. We're educating the Medicare beneficiaries to make good choices. We screen them for financial assistance programs. Typically, each year, we save over $25 million for Medicare beneficiaries in the state of Ohio. So it's good work. There's a huge demand. Our program isn't growing as fast as the demand, but it is very rewarding work.
That's amazing. Well, I have to say that I think the last time I spoke with you, that Channel 1, the Spectrum channel, is where I first saw your commercials. So every time I see the commercials, I think, oh, well, Chris is running those commercials because I told her that I saw them on Channel 1, which I know is not so. But it is a very good source to run commercials on the different channels. And you do more than Channel 1, I'm sure.
I'm glad. As a government-funded program, we cannot do the media that the large insurance companies are running that you see throughout. So the fact that you saw that and reached out to us means a lot. And inviting us here today. Our program is 30 years old this year. I've been around for 25 of that. And I still think we are one of Ohio's best kept secrets. We want to do more for the Medicare patients out there.
Oh, very good. I'm sure that you have stories to share from people who have reached out to you and gained just peace of mind from your help. Can you think of any offhand that
I can think of so many. I think, and especially speaking for my analysts that are on the phone, when you call OSHIP, you're not getting a call center across the country. We have 10 full-time analysts that are on the phone. We bring in a little extra help each year for open enrollment. But these are Ohioans, taking calls in Columbus, Ohio. They know the landscape of the plans that are here in Ohio, and they're here to help. But the ones that kind of stick with me the most are sometimes the simplest phone calls. To them, these questions were overwhelming, and they couldn't see the light at the end of the tunnel. And it's after just some basic Medicare overview and taking the time to explain the differences between the plans. Maybe they saved money, maybe they didn't. But when they hang up the phone, if I am confident they understand the insurance coverage that they have and what they need to do moving forward, those are the most rewarding calls.
Well, I think that is so important. I would think you would gain so much satisfaction from knowing that you have helped.
We do, and I think that keeps our staff going too. We have a lot of longevity within our program, which isn't quite as common these days. But I think at one point it was hundreds of years that we tallied up to for experience. So hopefully folks will give us a call. Like I said, we'll provide objective, unbiased information. A lot of times, what should I do? We can't tell you what to do. We can give you the facts, we can give you the education for you to make an educated decision on your own.
Well, I mentioned to you that I'm seeing tables set up at festivals and so on and so forth with Medicare banners and so on. What is that? What is that about?
Well, it could be anything.
Okay.
The one thing I always caution, know where your information is coming from. I just recently did a report for the Senate Budget Committee on different issues with Medicare marketing, and we learned that over 100 outfits in Ohio use the word Medicare in their title. It's legal, it's totally okay, but we do see a misconception with consumers that they're talking to someone that works for Medicare and not a broker or an agency. So the key thing is know who you're talking with. A lot of local agents are wonderful. This is their livelihood, and they know the local landscape. But some of these other large outfits that you see advertised either on TV or at the fairs and festivals could be a large broker that is just trying to gather your information and sell it and start the robocalls and the mass mailings.
Good to know, because I'm sure that our audience is probably running into those situations, and I would say that that would be the first reason I would call you, is just to verify what is truth and what is not. And I think we're all looking for that, just in our lives today with so many social media postings and so on and so forth.
Well said.
Yes. Well, thank you so much. Future types of situations where you'll be speaking, or I know that we have some local posts that Joe's going to put up on the screen so that folks can see where Medicare checkup events are going to be held.
It's a busy time of year for us. Each year we host what's called a Medicare checkup. So just reviewing your current plan and looking at what plans are available for 23. And then again, if you need or want to make a change, you can do so by December 7th. So we have local events. You can call and get an appointment. I encourage you to bring at minimum your current plan information and your list of medications that you're taking to help us dive through the weeds of all these plans. If these dates don't work, they're not at a convenient time or location, they can call our toll-free number. Our analysts can counsel you one-on-one over the phone. We also we offer virtual counseling. So folks that are a little more savvy on the computer or their tablet can have a face-to-face counseling session with our staff using Microsoft Teams.
Well, I was noticing, and I'm happy that you brought the telehealth issue up, because I was reading that one of the areas that I think there's going to be additional assistance with is mental health through telehealth.
Yes.
Could you explain a little bit about that?
Mental health has always been a covered benefit with Medicare. It's just traditionally, before the pandemic, it was in person at an office. So through the pandemic, really with mental health and physical health, Medicare opened the door for telehealth options. So if individuals have a smartphone or a tablet or a laptop or a computer, they can connect with their physicians via those services and talk one-on-one. Medicare will continue that. So you can have mental health counseling in the comfort of your own home. And I think part of the hope behind that is you're comfortable at your home. You might be more apt to taking advantage of that benefit. So Medicare is hoping that the utilization rates for mental health and outreach extend. I know our office, the Ohio Department of Insurance, we've recently expanded our mental health insurance assistance office. So if anyone, Medicare or not, is having issues with utilizing mental health benefits, we are a resource for that as well.
Oh, that is great to know. Well, I've been a mental health advocate my whole life, just because I just feel like, I always say, I think mental health checkups should be seen similarly to dental health checkups. And, just thinking of total whole health, wellness, and so forth. So I'm happy to see that you're involved in that, providing those services.
Yeah, and that is a huge initiative with this administration. So we are seeing great strides. And again, the end goal is to see those utilization rates increase.
Right.
And then maybe one day we'll talk about dental benefits added.
Well, if there's anything, I'm always interested in dental health, just because I think it's one that I've used more. And when you pay out of pocket, that really starts to mount up, and it, it can impact.
It can.
You
and
in
a lot
many
of
ways.
The Medicare Advantage plans often advertise dental benefits, those extra benefits beyond Medicare, as an enticement. So again, I would encourage folks, know the specifics of that dental coverage. Typically, it's going to be a cleaning. There is an extended coverage for root canals or dentures or things of that nature. Right. But we're hopeful. There are conversations going on at the federal level to include dental benefits in the near future.
Because dental is part of your body and is a very important part of your health.
Yeah, leads to better health overall.
Right, right. Very good. Any future events that I know you're on your way to another presentation today, and are you going to, be holding conferences or speakers?
We do. In addition to the counseling events that were posted up for folks to join in, I have a team of field staff. They're community liaisons.
Okay.
And they're assigned territories across the state of Ohio. So this is their busy time as well. We are traveling daily throughout all of the 88 counties in Ohio, conducting educational trainings, presentations, anybody that'll have us. Our calendar is full. So those events can also be accessed at insurance.ohio.gov or call our toll-free number to find out if there's an event local.
Okay, very good. Well, this has been so interesting, and I appreciate you taking the time out and walking us through maybe some of the changes that are happening. But to not feel intimidated by calling you and just saying, where do I go from here?
Exactly. Yeah, thank you so much for having us. This is a great opportunity to share the objective information and get the word out that we're here. We're here to provide objective, unbiased information and hopefully guide folks down the proper path.
Very good, very good. Well, I thought that maybe you might like to join us. I know I have a little treat today, a follow-up to a program that we actually taped several months ago. Featured a very good friend of mine, Sharp Hope, and she is very musically talented. Well, she joined along with 3 other very talented musicians that she knows in Tiffin, Ohio. And this performance happened yesterday in Heidelberg at the Heidelberg University. And I live streamed the performance. And what it is, she got these friends together at her home during COVID. And she has 2 grand pianos. And she created musical arrangements for 8 hands, meaning that they all play at the same time different parts. So as you'll notice on this concert, well, it went an hour and a half, hour 45. We're just going to show a little bit of it. But it's really something that evolved, as did telehealth. This evolved through the COVID lockdown time.
Wow.
And so they usually had masks on when they were playing at Char's house, but as you can see, they had a sellout crowd in the auditorium and then offered it streaming. So this was called Piano Stachio is the name of the program. So welcome to a little listening of Char Pope and Friends and Piano Stachio. We've never done this before, so I wasn't quite sure if I haven't said that if you're watching. So here we are listening to Piano Stachio live streamed. So once again, it was something that the idea evolved during the pandemic, and it remains now. Mm-hmm. And I'm so delighted that we're able to share this with you. And actually, you can see Piano Stachio on YouTube. And if you are watching us on YouTube, like us, share us, and subscribe. We hope you're feeling good, and we'll see you next time. Bye for now.